Are you dealing with recurring symptoms of abdominal pain, bloating, acidity, intolerance to certain foods, nausea, diarrhea, or constipation? Have you been consulting with a gastroenterologist for any digestion-related health problems? Have you wondered about stress and lifestyle as contributing factors to your digestion? Did you know that the mind has a role to play in gut health? Most of us are familiar with the butterflies in the stomach feeling before a stressful event, be it writing an exam, giving a job interview, going on a first date, or watching a scary movie. This illustrates the mind-body connection, specifically the gut-brain axis.
The GBA is a two-way communication street where brain activity influences gut function and vice versa. Therefore, the health and functionality of both matter. The GBA is impacted by factors like biochemistry, nutritional intake, and stress. The GBA works via three mechanisms: the vagus nerve, neurotransmitters, and the gut microbiome. The vagus nerve is a long nerve connecting the brain and gut that is responsible for rest and digest, and when activated, it can trigger a relaxation response. Neurotransmitters also play an important role. The gut is known as the second brain, and a healthy, well-functioning gut produces more than 90% of serotonin, a chemical which plays a role in healthy digestion and mood. The gut microbiome, which consists of trillions of diverse bacteria in the gut, regulates inflammation, digestion, and brain function. Any imbalance can lead to mood and cognitive-related problems. Sometimes, there can be recurring or chronic disruptions or disturbances in the gut-brain communication, which are referred to as disorders of the gut-brain interaction, DGBI. These include conditions like irritable bowel syndrome, gastroesophageal reflux disorder, chronic indigestion, and inflammatory conditions like inflammatory bowel disease. The physical symptoms like bloating, cramps, acidity, etc. that are associated with these conditions can adversely affect mood, concentration, interpersonal relationships, work functionality, overall quality of life, and increase stress levels itself.
A major study found that people with IBS are at an 8-fold higher risk of developing anxiety and a 7-fold higher risk of developing depression. This is not a coincidence, but rather an indication of how one affects the other.
There is growing evidence for using an integrated treatment approach in dealing with disorders of the gut-brain interaction. This means that the interaction between both need to be understood and addressed through a multidisciplinary treatment approach. The biopsychosocial model looks at how one's health is influenced by the interaction of physical body, mental, and emotional states and the social world, thereby treating not just the symptoms but the whole individual. Research suggests that there are ways of altering the gut function through application of evidence-based psychological techniques. The idea is to use the power of the brain to calm and regulate the second brain, or the gut. Psychological approaches like cognitive behavior therapy, gut-directed hypnotherapy, and mindfulness-based strategies are being used to alleviate psychological distress, which in turn affects gut functionality and quality of life.
Digestive symptoms are real, and the mind-body connection is real. The gut and brain get stuck in a stress loop which can affect both mood and digestion. Meeting with a mental health professional does not mean that one has a character flaw, is weak, or is imagining one's problems. Psychological support does not replace medical care. In fact, it complements it and improves overall quality of life. The psychological support offered here is in the form of coping, regulation, functioning, and not putting labels.
Your digestive health is about more than just what you eat. It's about how your whole system communicates. Dealing with the symptoms and feeling better is not about choosing between medical science and psychological science, but rather, it is about getting the best of both by integrating them.
At Augmenta Health, we believe that mental health does not live in a vacuum. It lives in every system of the body. So, the next time you visit, ask your gastroenterologist about the role of the nervous system in your digestive health, because mind and body are on the same team. Starting this conversation will ensure that you're giving consideration for the whole individual and not just the symptoms.